This week on Health Garage.
Many people get conditions that are going to limit them in, say, like moving the arm, moving the neck, moving the legs, and whenever one part of your body is not functioning well, trust me, you have a limitation. So like you cannot do your daily activities. You cannot walk to the bathroom. You cannot lift your baby. That's if you're a nursing mother. You cannot even feel him because your arm is, say, like stiff. Your shoulder is stiff. Your elbow is stiff. There's no way you can walk. So we help out the patients to restore movement.
Welcome to Health Garage. Many of us overlook the importance of physiotherapy or physical therapy until we are faced with an injury or need to restore movement. But the truth is, physical therapy is a game changer for improving our overall quality of life. Join us as we explore this vital topic with an expert physiotherapist. Don't forget to follow us on social media at Health Garage for more health tips and insights.
My name is Justin Nachimpi. I am a physiotherapist by profession. I head the physiotherapy department in the hospital, but as well, I'm the head of the rehabilitative team, and it is a variety. Yes, we are many rehabilitative professionals, and we are all on board. Yes, so this rehabilitation unit is having the physiotherapists, it is having the occupational therapists, it is having the speech therapists, we're having the social workers on board, we're having the psychologists or psychiatric doctors and nurses on board. Also we have the prosthetics and orthotics services, though they are outsourced, and some of the professionals I've told you that are on board, the rehabilitation team members. Some of them are outsourced, but at least they come in consultation. Yes. We also have the nutritionist on board. Physiotherapy, in simple terms, this is treatment using physical means. That's what we can say. And we work on a variety of conditions. One, we ensure that at least we try to restore movement and function. It is one of our utmost goals. We restore movement and function. Many people, they get conditions that are going to limit them in, say, like moving the arm, moving the neck, moving the legs, and whenever one part of your body is not functioning well, trust me, you have a limitation. So like you cannot do your daily activities. You cannot walk to the bathroom. You cannot lift your baby. That's if you're a nursing mother. You cannot even feel him because your arm is, say, like stiff. Your shoulder is stiff. Your elbow is stiff. There's no way you can walk. So we help out the patients to restore movement and function, so that we can improve on their quality of life. So the conditions that people have, it might have just occurred. Before you know it, you have your shoulder frozen. You have your neck stiff. You have your knee paining. You don't know how it started. In the morning, you have your neck, it is paining too intensely that you don't know what to do, or you don't know how it started. Okay? So the people who are so like that have involved in accidents. So like someone gets an accident and they break their arm. They go into a cast. Afterwards, since the joint has been immobilized for some time, you need to rehabilitate it back so that it can be free to move and also work. Okay? So we also have patients that are so like hit by stroke, that they have one side which is weak, Even those, you have to make sure the brain is coordinating well with the lower parts of the body, because the brain is our master. If it has a problem, depending on which side is affected, then that side that is affected will not be getting command. And for you to get command, the brain must be well. You need to stimulate it so that it can send the signals. Please, arm, lift. Please, elbow, bend. If your brain is having an issue in regards to movement, that means you cannot move that part of the body, if at all the brain is affected. The department is a 4-roomed department plus a gym. Yes, it has 4 rooms, it has a gym and a reception. So in the 4 rooms, what happens there is basically treatment, because we are observing privacy. Not everything can be done in the gym. There are points where you have to work on a patient's backside, maybe the arm of which, for you to get access to the arm, you have to remove the brows or shirt. So we observe our privacy in those different treatment rooms, okay? So that you can work on the patient freely when they can open up to you. And sometimes people can't speak in public. You cannot tell the patient, the therapist, all your problems when other people are hearing. So we observe privacy by having our different rooms, 1 patient at a time. And if at all they allow a caretaker to be with them, that is also by standard that they need to have a caretaker at least, so that if at all they are given home exercises, someone is there to remind them. So like the elderly, there's no way they can remember what you tell them. So with that, we need a caretaker with them. And usually there is someone with them in the room. Yes. My patient numbers have grown beyond expectation. Because if at all, in 2015, we were looking at about 10, 15 patients. And if now we can manage 25, 35, minimum. Actually, minimum 25, maximum 35, but on average, 35. Average 35, maximum 40, average 35. We have really grown in that. The other thing, we have this donation. We have grown from a 2-room department, or from a 4-bed department, 2-bed department, to a 4-bed department with a well-equipped gymnasium. That is a great achievement than to cure. It is very expensive to go the other way around. Let me talk about preventive. According to our business schedules that we usually have, since morning you've been on that camera, you're adapting those awkward positions, you're trying to fix your camera to face that one that way. In due course, you're twisting your neck in different positions. At the end of the day, there's a lot of tension that creates within them. So, at least a day, every day, even if you have 1 hour of exercise, that is very important. It is very good for your health. So, we don't wait for pain to come. We don't wait for a condition to come. As I told you, pains can come from anywhere. Because of the tension, because of the accumulation of lactic acid in your body, in the muscles, pain can stuck anywhere, anytime. So for you to prevent all that, always it is very good to consult with a physiotherapist. Come, we talk about the schedule. First of all, you must have a goal. What do you want to achieve? Do you want to keep fit? Do you want to lose some weight? Or do you just want to keep healthy? For me, why I'm here, I want us to develop a schedule. What can I do to get this and this and this? So depending on what you want to achieve, then even the interventions that we're going to set, or the objectives that we're going to set, are going to be, and the intervention that we're going to use are going to be in line with your goal. So the other category of people that we get are the people who are affected by disease. They come in with pain. There are those after accidents. They have done the first part of the orthopedic people. They have done their part. And then you also have to come in and rehabilitate back to function. Okay? Yes. Then others, patients, the ones that maybe the ones that are hit by stroke, others have birth injuries, many things. We have different categories. Those who are having injuries and those who are, they seem okay but they are in pain. And those after a trauma. One should choose Ruvaga Hospital because we have the best professionals, we have the best equipment, and we have the best customer care. So I call upon everyone to join in. Many people have gone ahead to visit different departments around Kampala, but they have not gotten a change. Come and we see. We do that thorough assessment before we do anything. Because when we do that thorough assessment, we are able to identify the problems of the patient very well. And then we set realistic goals. Then we discuss this patient treatment plan with them. Then we see how we're going to achieve it. Because when you set your things, you start doing your things without involving the patient, you will never achieve. So this is the uniqueness about us. So this is what we call our gym station. Yes, this gym station, it has components that can work on the arm. It has components that can work on the chest. It has components that can work on the legs. So maybe I can demonstrate. So we said we have components that we use to. That is for the biceps. Also have this, which we can use. Also we have the quads bench. We call it a quadriceps bench. This one, we use it to exercise our legs so that they can get some strength. Okay? Yes. So, that is it for the gym station. So it has different weights depending on what we want to achieve. Some people want to we want to get strengthening. So depending on what the patient can afford in terms of strength, that's when we adjust the weights. We also have a stationary bike. Yes. We use it for knee health, basically. Okay? We use it basically for our knee health. So you might be asking yourself, why do I have stairs? I have patients who cannot take steps. They cannot. When they walk, they have these chicken steps. But with this, it helps you to exercise the knee, the person as a whole, but it helps us to improve our gait. Also, training someone to bear weight, especially when they are recovering from injury. Okay? Yes. So we have people who cannot walk. They cannot support themselves when they are walking. So I have what we call the parallel bars. So if at all someone is in a wheelchair, but you would wish them to get the feel of walking, you want to help them get back to function of moving. Even gaining strength both in the arms and then the legs, we can use it for training walking. Okay? You want the patient to learn how to walk and stabilize, because it has supports on either sides. Someone is not scared of falling. Okay? Yes, someone is not scared of falling. So you're looking at my mirror. It is not for beauty. The mirror is a great tool for rehabilitation. If someone, you might be telling someone that, you know what, when you stand, you fall on one side, but they cannot observe themselves falling down on their side. They cannot tell that they are falling on the side, okay? So when they observe themselves, so like I can ask you to stand in the mirror for 15 minutes. Observe yourself. If you see yourself turning to one side, please come back. Put yourself in line. So it helps us to, we call it posture awareness, posture training, okay? Yes, you feel more motivated, one, and you become aware of your position. If you're falling this way, please, you can easily tell that, I'm on the left. Let me bring myself to this, to the what? To the midline. And in due course, you're strengthening muscles. You understand that? Yes. You're strengthening the muscles and you stimulating the brain. If at all that center of the brain is not coordinating it very well, you'll find yourself having more coordination. We have what we call the quads bench. This is basically for strengthening the legs also. Yes, strengthening the lower limbs. Those bath balls, they do a lot depending on what you want to achieve. We can use it for strengthening. We can use it for balance. So they can do a lot. So these are the bath balls I'm talking about. So this is called a wall bar. Okay? This is called a wall bar. This wall bar helps us in many aspects. Okay? You might find a patient who has limitations in the knee. Their knee is paining and it is limiting them to squat. So, I want you to try, go that much that you can go, as long as you supported yourself. So, we train that activity of squatting, okay? They can go up to down. And in due course, we even strengthen the muscles, okay? The spine cord, not so much, but you stretch. You can get a stretch in the muscles of the back, okay? Only that we have different reasons why we come here. So like for a patient, a stroke patient, you cannot lift the leg up. But at least if at all I do the squat, it is good. I might get the weight I want to be buried into the legs. So I get that weight bearing. Okay? I position this other one which is sick, and then the normal one will help me a lot. And then we go down. We do the squat. We come up. Okay? So it is more strengthening. Not only for that, also for the children. Yes. So you can take it as a play, like they are climbing. But for you getting your strength in the arm, the strength in the leg, they are taking the steps you want. They are taking it as a play exercise, but for you are achieving. At the back of your mind, you know what you want to achieve. So this cross trainer, good enough, it exercises both the legs and the arms. Okay? If I only want to exercise my legs, I can go for this. And it is very good with hip pain also. Hip pain? Yes, because when you're doing this, your hip is moving. They're just there. Someone has gotten a wrist problem. They had a wrist fracture, and now they are recovering. So, you find that you really need to, yes, you need to exercise them. They need to get some strength. You find patients who cannot even bend there. So I have to support my arm here so that I can localize the movement, okay? I only want movement in the fingers, right? So meaning how, then it will have to, it has weights down, Yeah, they have weights down. So when I pull, because all I need is to get this. I want my fingers to stretch but with some weight. At the end of the day, I'm looking at mobilization, but at the same time, I'm looking at strengthening muscles of the fingers. Okay, you seeing that? Yeah. So, I think that's it. Anything else that we have not talked about? No what? You know, our hand, it has many movements. It has movements in the arm going up, the hand going up, going down. So with this, we have what we call supination and moving the forearm forward, the hand up, and then making the palm face down. So with this, so we have patients who cannot even try to do this, cannot have this movement in the arm. Okay, so we try to use this so that we can improve the range of motion and also the grip. Yes, so it is not rough for nothing. How can we keep fit? So when we are talking about keeping fit, we are not looking at just exercising alone. We're looking at, first of all, regularly exercising. As I said before, at least in a day, 5 days a week, at least you exercise 1 hour daily. What do I mean? Exercising does not mean you're going to run. Let's start slow. Doesn't make sense. You run for 1 minute and collapse. What you do? Start by walking. Listen to your body. If you feel tired, it is okay, take a rest. If you targeted yourself to do 1 hour, okay? It's okay, you can have 5 rests in between of 10 minutes. But as long as you complete your 1 hour, okay? The resting, that is resting time. If you walked for 10 minutes, you feel tired, you rest, okay? Because when you force, your muscles are not yet used to the exercise. So when you keep insisting, you will collapse, then you'll not get the benefit of the exercise that you wanted. Okay, 2, we should take a lot of water. Okay, we should take a lot of water. 3, we must watch out our diet, because you might have a goal of reducing weight, but every time you burn calories, you burn 10, you load 50. That's why some people say when they do exercise, they gain more weight. Do you know how it comes? Because they exercise, they feel they are too thirsty, they are too hungry. Before you know it, they are eating more than they even burnt. So when they do that, weight will just increase. And whenever your weight is high, we have a lot of fatty deposits. You are at a very high risk of developing diabetes, high blood pressure. Many things move together, okay? And your quality of life is going to be down. So when you exercise, you're going to burn down those calories. You're going to have better mood. Even your productivity is going to improve, okay? Because if at all you can only sit for 5 minutes, then get up. How are you going to complete a document? So like you're making a report. You have to submit it within 1 hour, but you cannot sit for 10 minutes. Every time you have to sit up, to stand up, do ABC, again you sit. At the end of the day, you're not going to be as productive as someone who has been fit, okay? Also, we reduce sitting, okay? If at all you want to keep fit, you must reduce your sitting. If you don't reduce it, meaning you're going to cause yourself many health issues, like back pain, okay? You sit for long, you're going to load those vertebrae so much, the ones that are supposed to bear weight. Before you know it, there's a lot of tension created within the muscles of the back, At the end of the day, you're going to have intense pain, and then you're going to visit me and give us money. So we can avoid all that by making sure, let me give you some healthy tips. If at all you sit a lot, every 2 hours, get up. Just walk to the bathroom. Stretch a little, even if the stretch is for 5 minutes, go back and sit. Do your work. Every after 2 hours, make sure you do some neck stretches, okay? Because you have been putting, so like you're concentrating on this computer, your neck is all tense, okay? There's a lot of accumulation, a lot of tension is created. But every after 2 hours, when you do stretch, you relieve that tension. At the end of the day, you find yourself doing more compared to when you have been seated for 6 hours. You're going to get back pain, neck pain, even you're going to sleep because the body is not going to allow you to do any more work. Okay? I believe with that, we can live better if we exercise more, if we do drink our water, we drink at least 3 liters a day. Let's try to flush our kidneys, okay? We said we reduce sitting. Let's exercise regularly, that is at least 5 hours a week. That is on a daily, we can do 1 hour, okay? We observe our diet. Reduce carbs from your diet because when they reach the body, they transform into the fat, okay? When it transforms into the fat, those are the fatty deposits that we are going to find within blood vessels. And at the end of the day, hypertension is on your door. Diabetes is on your door. So to avoid all that, let's try to observe some of the healthy tips I've given. Thank you.
Thanks for tuning in to Health Garage. Remember, regular exercise is key to staying fit. Take breaks to rest and stretch, especially if you have a job that involves sitting for long periods. Every 2 hours, get up, walk to the bathroom, stretch and do some neck stretches. By exercising more and taking care of your bodies, we can live better. See you next time on Health Garage. Keep it healthy.
The Health Garage, transforming lives one healthy choice at a time.